Yeah, from Daisy Dukes to business.
Hi, and thank you for joining us for Behavior Health and Wellness. I'm Dr. J, and today we have a very special guest. We have a representative here from the Susan G. Komen organization, and I'm going to let her tell us a little bit about herself, Miss Lisa Plunkett. Thank you for joining us. How are you?
Great. How are you doing this morning
I'm
today?
well, very well.
Well, good. Yeah, thank you. My name is Lisa Plunkett. I'm the executive director of Susan G. Komen New Orleans, which is an 8-parish region. It's basically the greater New Orleans metro area. Anywhere that you can think is a stone's throw of New Orleans, that's where we are, and those are the parishes that we serve. We're based out of the New Orleans metro area, but we do, we serve with breast cancer screening, treatment, and educational services throughout our 8 parishes. We have a upcoming Race for the Cure that's going to be virtual, which we'll tell you about. And, basically we're here for the community. And it's not only women, it's women, men, and children, because breast cancer, as you know, affects not only the woman, it affects her whole family unit. It affects her friends, her parents, everyone that has contact with the woman. With a woman or man who has breast cancer, who's been diagnosed.
And I'm glad you brought that up. Can you tell me how, I know COVID has affected us all in some way. I mean, drastically in some cases. How have you all been able to still provide services during COVID and to try to keep people safe?
Well, thank you for bringing that up. That is a huge concern. Earlier this year in, March, April, I mean, everything had, it was like a standstill. No breast cancer screening, no surgeries, no anything. So everything was basically put on hold until our healthcare system could, see what was happening with COVID-19 and, make sure that they could keep insured people's safety coming in for a routine screening or coming in for, a breast cancer surgery, mastectomy, lumpectomy, and also chemotherapy and radiation, because, breast cancer didn't stop even though we stopped, right? We stopped doing things that we normally did, going to church, meeting with people outside of our own family unit.
Family.
Yeah, exactly. Seeing family in person and hugging them. That's big. I was on a city council meeting earlier or last Thursday, and, just seeing the city council members in New Orleans, and I'm like, I want to hug you guys. I miss you. I miss being in the council chambers. I miss seeing your staff, and just the normal things that we go about. But breast cancer didn't stop. And, people women and men who've had treatments, in fact, treatments ongoing, and our hospitals, our cancer centers are doing their best to ensure patient safety, because that's first and foremost. And the breast cancer chemotherapy and radiation is continuing, and they're doing it safely. And now, since, a few months ago, we are doing breast cancer routine screenings safely. So we don't want to have those bad outcomes that, we've heard about in June and July, of people waiting to get screened, for their routine well woman health care, right? They're saying, oh no, I'll wait and I'll put it off. I don't need to do that right now. But you do. You need to make sure you have those screenings, because if breast cancer is detected early, it's that much curable. And so we want to make sure that they're teeny tiny and they're small and they're detected by a mammogram, that you can't feel a lump, right? So we need to make sure that people are safe. And right now, our hospitals, our clinics, our diagnostic imaging places are able to do that for routine well woman checkups.
Good. That sounds wonderful. And it's October. And October is just like, I mean, it goes hand in hand. Soon as the last day in September, we pull out our pink and we start to prepare, because it definitely is something, even if it's just a little, I believe that this is a small gesture, but it's an opportunity just to show support. Because I know right now that the organizations, the scientists, you guys are doing what you can in order to fight this deadly disease. I mean, families, we're in COVID, we can't really visit as we used to, and that's an important component, especially to someone who may be experiencing something so life-changing.
It
So
is.
we pulled out our pink and we all ready, and now we're all at social distance. How are you all handling the breast cancer, the traditional, the annual breast cancer walk that I look forward to every year? How are you all handling that?
Well, I mean, right about now, we would be preparing, we would be going out to City Park and near Roosevelt Mall and, you know, doing our routine checks for the area and ants and making sure the grass was cut here and lower here for our Teams Village and our sponsors so they can set up tents so women and families and, you know, all of our sponsors could come out and enjoy the day and celebrate the day because, you know, whether they're honoring someone who has been diagnosed or celebrating those who are doing well with breast cancer treatments. You know, we had a ton of people, you know, we have tons of people that usually come out all in their pink, sometimes in costume. It's wonderful. And it's joyful. It truly is a joyful day. And it's one that we're at the end of it, we're like, wow, this just happened. It was so great to see our friends and family and people, right? Now we're doing it virtually. So our campaign now is, you know, hashtag race where you are, because we want everyone to be safe. You know, in years past, we've had to fund our mission in the greater New Orleans area, we've had a registration fee. This year, we don't have a registration fee because we want everyone to feel like they are involved and supported in the race for the cure. You know, we're having our race on race day, which is our traditional race day, the Saturday before Halloween. And so this year it's Saturday, October 24th. And we're asking everyone to, you know, put on your pink and, you know, walk outside of your house, walk outside of your office, go to your neighbors and who normally interact with, you know, to safely distance, wear your masks and safely walk and just support Susan G. Komen. Remind others to get a screening mammogram. And then also fundraise if you can, you know, because you can go online to KomenNewOrleans.org and register and to be part of our community, so we can be in it together. If you want to fundraise to get a participant shirt, you can do that. If you're a survivor and you register, a breast cancer survivor, you'll still get your pink shirt. And so that's the good thing. So, and we're going to have a drive-through Race for the Cure packet pickup. Normally we're at the New Orleans Fairgrounds, and this year we're going to be, you know, in an enclosed big area where teams would come in, they would pick up their t-shirts and, you know, buy pink items and just, you know, come for a few hours and celebrate prior to race day, right? But now we're going to have a drive-through. So you can get breast cancer literature. You can get a few sponsored giveaways like Folgers, who's one of our great partners. They'll be there. LCMC. You'll have the Ray and Jessica Brandt Family Foundation. We're going to have other sponsors there in a limited capacity because we don't want to overwhelm people, and we want you to drive through. And if you're a survivor and you're registered for the race, you know, we'll click it off and check here, and we'll give you a race number. I mean, your race pink shirt. And if you're a supporter as far as fundraising and you've raised $100, and it's not just you raising $100, it's, so if I raise, you know, self-donate, you know, $25 or $30, which would be a normal race registration fee, but then I do a Facebook fundraiser, or, you know, an aunt or, you know, your husband or your mother or whoever will donate to your, you know, race fundraising, so you can get the participant t-shirt as well. And that enables us to, you know, continue the things that we do right here, our mission in the New Orleans community, to fund those breast cancer screenings, to fund those treatments that, you know, help fund the treatment, and also help fund, you know, some of the things that fall through the crack during this time, you know, in a time of a breast cancer diagnosis, like an electricity payment, like a rent, like a childcare cost, like medications, because we have that safety net. We're here as that safety net to help people, you know, not with a fund directly to you, but through our grantees. And then later it'll be through our treatment assistant program with Susan G. Komen. So it's really great that we're able to personally touch people that need it here in our community.
These are some very uncertain times, and I commend your organization for you can see the hard work and dedication that you all have put into adapting to what's happening with COVID, especially with the underlying condition. We have to be very safe with those participants. So reminding people to wear their masks, to still stay socially distanced, however, to still acknowledge and to show up for the cause. So tell us where those sites are going to be, where they can actually pick up their shirts. And also, I know you said you can visit the website to register, but just make sure that they have the information so they know where to go, so they can participate on, that's the 24th, right? October 24th.
Saturday, October 24th.
Tell us where we can go.
Well, so go to KomenNewOrleans.org to register. And they'll also have lots of other obviously we'll have breast health information, and we'll have places where women can go and get screened. So you can click on here, do I need a mammogram? If I feel a lump, what do I do? My mother lives with me, and I know she hasn't had a mammogram for over a year. We need to get her in as well. So, it's information that all women need, and all men need as well, because for their partners, for their wives, their sisters, their aunts. So we really need to make sure that everyone's covered, right? And that's what we're here to do. But you can also get information about the race, the Saturday, October 24th, Race Where You Are, and register. And there's fun links there too, to pink your porch and to pink your pet, and to, we have people actually doing little videos, just with their cell phone, right? You're holding your cell phone and you're saying, hey, that kind of thing. I'm racing where I am, join me. When I say join me, I'm saying join me virtually, like we're doing right now, to share those videos and tag Susan G. Komen New Orleans, and tag race, hashtag Race Where You Are. But when you fundraise, it'll lead you to a link telling about our packet pickup. So the packet pickup will be, the first one will be Friday the 16th of October in the afternoon. Those times haven't been committed yet, but I think it's going to be sometime around 2 to 5 p.m. At Children's Hospital. We're going to be right in the little alcove where you can drive through. So, and we can say, hey, you're registered, great, here's your t-shirt, here, we know you're coming, click off. And same thing for survivors. Here's your t-shirt, because, especially breast cancer survivors, they look for that pink t-shirt. That's it's a badge of honor. It's a badge of pride to say, hey, look at me. And, when I see people in the grocery store, I'm just like, wait, what, do I know you? And I'm like, yeah, I know you, it's because you're committed to them. Right. And it's like, I know I've seen you before, especially when they're wearing that pink t-shirt, or even the race participant t-shirt. For a few years ago, they were white. Right. And so for many years they were white, and now this year they're gray. Last year they were gray. And so I don't know, but my mind, when I see them, I'm like, oh, okay, that's last year. I know you were there at the race. I saw you, right? And, we'll miss seeing our people. We really, really will. I mean, there's some people that come to the race every year. We have people who, wear a costume every year. She wears a yellow duck costume. She's there every year. I take a picture of her every year. I mean, it's awesome. We had people that were dressed up as cats last year. We had Wonder Woman. We had, it's just fun. And so, but it raises awareness.
Right. The entertainment, just all of the participation is just overwhelmingly wonderful for such a great cause. And you mentioned earlier also, we can get to the point whereas, you get such a devastating outcome, you might not be able to pay your bill, or you may need some type of support. So I know you all are still right now taking donations. Where can somebody say, look, I just want to make a donation, or I just want to fundraise because this is a great cause? Where can they reach out to get that to you all?
They can go to our website at KomenNewOrleans.org. They can also go to our Instagram at KomenNewOrleans.org, and they can, it'll lead you right to a donate, and you can donate in memory of someone. You can donate in honor of someone. You can make a straight donation to the race, and basically it all goes into the same place, and it's able to help, our people locally in the greater New Orleans area. And it's also, more importantly too, to help for research, because, people say, you've been doing this for so long, when are you going to find the cures? Because it's not just one cure we're searching for. There's many different types of breast cancer in many different stages. So, you're looking for cures for a multitude of problems, or not problems, but, it's like puzzles, right? Because when you have one cure for, or treatment that works good for one type of cancer, like a BRCA 1 or 2 or triple negative, or just all the different types, right? You will find the better cures. In searching for the cures, you'll find the better treatments. And that's what we're striving for as well. Because, if you were diagnosed today versus 10 years ago, the treatment is so much different, right? And it's wonderful because we have those fundraising dollars to put into those researchers, right? Who are not in front of the camera, but they're in the back lines saying, here's the next step. Here's the next step for finding the cure for triple negative. And we need to be able to do this, which will lead to the trials, right? And the clinical trials. And that, just like people are kind of learning a lot more about clinical trials right now, especially during COVID-19, about, trials for a vaccination. But, it's like that with different cancers. You have to have those trials before you can, have these accepted treatments.
I'd like to thank my guest, Ms. Lisa Plunkett from Susan G. Komen, New Orleans, for stopping by. She gave us some very important, valuable information. Right now, we are experiencing a life-changing historical social distance. We are the new normal. We're not seeing each other as we are accustomed to. We had to make a lot of changes with every aspect of our lives. And the annual Susan G. Komen Breast Cancer Walk is one of those changes. However, they have made the opportunity to participate online. You can participate from the comfort of your home. They have waived the registration fees. And I mean, we all just still have to do our part and fight cancer in any way that we can. If you want more information about Susan G. Komen, or you want to find information out about breast exams, mammograms, screenings, make sure you reach out to the office. You can give them a call at 504-455-7310. That's 504-455-7310 for Susan G. Komen, New Orleans. I am so happy you were able to join us for another segment of Behavior, Health, and Wellness. And remember, you can take preventative measures in order to be healthy. You can make sure that you are going to the doctor. You are keeping up with appointments. Right now, we definitely have to make sure that we're doing everything we can do in order to prevent, as opposed to going to the doctor as we once were able to just make those drop-in appointments. We can do some things to make sure that we're taking care of ourselves in the meantime. So until next time, in the meantime, take care of yourself. It's me, Dr. J. Be well.